important that we recognize them, understand that we understand their hurts, their pain, their suffering, and we wanted to make sure that we support them. But we also have to make sure that we're protecting this community. And so I just want to let all those who've been on the front lines for the past 4 days, letting their voice heard, let them know that I hear you, I see you, and I'm with you. And I want to also thank everybody that came out yesterday to help out with the cleanup from what happened over the weekend. I know had a chance to go out there as well and mingle with many of the folks. So it was a good chance to see so many folks and see so many people to come out and to clean the city of Milwaukee and other places to show our support and solidarity with the protests. I also want to say that if you're looking at our screens, you'll see that it is blacked out. This is Blackout Tuesday. And so we want to show solidarity of everything that has been going on. And so that's the reason why you see this blackout in the background. But we also are kind of changing things up as it relates to the message. So we want to understand that safer at home has not been a thing for everybody. And so we want to tell people as they come out, enjoy the summer, because we definitely know that we're not going to be able to keep people contained for so long, but to make sure that they continue to stay safe. And so, it's getting hot when you're going to the park. If you're going to go out and enjoy this weather, make sure that you are wearing a mask and protecting yourself. So you're going to see more billboards about Stay Safe Milwaukee. And it's just really to let folks know that we have to do everything that we can as we go into this summer months, knowing that we're not going to be able to keep everybody contained, but to continue to practice social distancing, good hygiene, and wear a mask whenever you can. Also, just a quick update on the national testing sites. As many of you know, they have started back. So they're going to be at UMOS and at the Custer Stadium today through Thursday from 11 a.m. to 7 p.m. and this weekend, Friday and Saturday from 11 to 5 p.m. But they will be closed on Sunday. And if there are individuals who are out protesting and you do feel symptomatic, please do not wait to call your doctor. Get tested. So please call 211 to find the testing site near you. And I guess to make sure that everybody also understands, today is definitely going to be a very hot day. And I know many people want to go out and enjoy Bradford Beach. And so we want folks to understand that we will not have any lifeguards out at Bradford Beach. So when we say protect yourself, make sure that you're keeping yourself safe as it relates to swimming, as it relates to wearing a mask, and continue to practice good hygiene. So I just want to let folks know about all of that, and I will hand it off to Mayor Berry.
Thank you very much, Mr. County Executive, and thank you for all your work. Excuse me, I want to share the sentiments of the County Executive. I think we all recognize that we are living in unprecedented times, extraordinary challenging times. And we as members of this community have an obligation to do whatever we can to achieve the America that we all want to see. The America that we want to see for ourselves, for our children, and for our grandchildren. And clearly what we are experiencing in real time is a jolt to the American psyche because of the COVID-19 pandemic, because of the economic fallout that comes from that pandemic, and because of the nationwide outcry for respect for African Americans and other people of color at the hands of police officers. This is real. This is America looking to find the best America. And I was just down on the south side of Milwaukee where there are literally hundreds of people who are marching because they want to have a better America. And so I am very cognizant of what we need to do. And that is to make sure that our police officers are respectful of people in our community, that we have to do more in the healthcare field. And this is why we've been talking for several months about the healthcare disparities and the racial inequities that we have in our community. And that we have to do everything we can to support each other as a community. So as much as I support those individuals who are out there peacefully walking and marching and protesting, I understand they're doing it because they want a better America, an America for all of us. At the same time, I recognize that there are individuals, usually much after dark, who are destroying property and are making it a dangerous place for people to be in this community. And we have to be mindful that making those decisions are not helpful to what we're trying to do, which is to make this a better community. I want to now talk a little bit about the testing because I think that that is important, and the county executive alluded to that as well. Yesterday, we had 215 people who tested at Obama Custer on the north side and 703 people who tested on the south side at UMOS. That brings our total of community testing. This is the testing that's open to everyone, to over 21,000 individuals in our community. As some of you may know, we took a pause for several days last week, for 4 days actually last week, because there was a backlog in getting the testing results. We feel that that is now headed in the right direction. We didn't want people to take a test and not get the results. We felt that was unfair to them. So there was a joint decision that was made, but now I'm pleased, and I know the county executive is pleased. I know many others are pleased that we have both sites now operating. And that's something that's very, very important. So we want to continue that. I will be speaking to the police chief again later this afternoon. I've spoken to him last night at midnight. I spoke to him earlier this afternoon as we make a decision as to what decisions will be made for tonight and going toward the weekend. I will say that from the accounts that I've received from the police chief and others, clearly in the period from, say, 10 o'clock until 2 a.m., one of the biggest challenges we have are people who are driving very, very recklessly. And that is something that puts people in harm's way. I've seen firsthand cars traveling in reverse at high rates of speed. I've seen people driving on lawns. That is not something that is conducive to safety, quite honestly. And it's unruly, it's illegal, and that's something that we really have to have our law enforcement have the tools to be able to control. So again, I will be talking to the chief later today, once again, as to the next steps that we take. But in this very trying time, with the pandemic, with the protests we're seeing right now, with the economic fallout, we as a community have to do everything we can to be supportive of each other as well. Thank you, and I'll turn it back to you, Catherine.
Thank you, Mayor Barrett. Now we'll hear from Dr. Ben Weston.
Good afternoon. Thank you. First to our numbers, we have 8,016 confirmed cases of COVID-19 in Milwaukee County and 286 individuals who have died. We saw over the weekend and continue to see each day the overwhelmingly peaceful protests that by their nature bring people together in close proximity. So while demonstration and expression and protest are a necessary and encouraged aspect of our democracy, it's as important as ever to be safe and mindful of our ongoing pandemic. Exercising the essential right to demonstrate and speak freely does not have to be mutually exclusive from maintaining safety in a time of COVID-19. You can protest safely by staying outdoors, continuously moving, by wearing a mask at all times and making sure those around you do the same, and by maintaining several feet of distance from each other. With each of these steps, we can greatly decrease the spread of disease in our community. Although you as a protester may be young and may be healthy, those that you interact with on a daily basis, your parents, your grandparents, your friends, may not fall into those categories. So certainly exercise your rights, demonstrate peacefully, but as you work to improve the historical and institutional inequities that we know exist in our and many other communities, also be mindful of the health of your community. Protest safely. Take simple precautions to keep us all healthy. Thank you. And I will turn it back to Catherine.
Thank you, Dr. Weston. Dr. Pollock is joining us. She was having a few tech issues, so she still will be joining us today. But as we wait for her, I will hand it over to Reggie Moore.
All right, good afternoon. My name is Reggie Moore. I'm the director of the City of Milwaukee Office of Violence Prevention. We have been out over the weekend, including last night until about 2 a.m. Other nights it's been out to 3 a.m. Engaging in support of the protesters in terms of passing out PPE and ensuring that people are, as safe as possible. I, definitely want to echo some of the challenges, particularly around reckless driving that's been seen. And the protest leaders are working to address that. Last night was particularly calm in the Harambe neighborhood, and I want to credit the protest organizers first and foremost, but also the Alderwoman Malele Coggs, as well as Deshay, who runs the King Drive Bid, and many others who basically communicated the fact that we all stand for justice, and we are committed to supporting the protest, but at the same time, we also have to stand up for a neighborhood that has been fighting back for a long time. And so we just also want to acknowledge the protest leaders who shared that viewpoint and, led the protest starting in Harambe, but throughout the community for about 15 miles. And I just want to say, as the director of the Office of Violence Prevention, that when we talk about racism as a public health issue, when we talk about violence as a public health issue, these are things that are structural, historical, and systemic. And we have to be committed to not just hearing, to not just marching, but being responsive to the demands both locally and nationally that are coming from this protest, and stay focused on what has led us to this moment and this movement that is occurring not only in this country, but internationally. And so we also understand and appreciate that we're in the middle of a pandemic, and that people are putting themselves at risk in terms of being in a large crowd and potentially exposing themselves to COVID. And so again, that's why we've been committed to passing out PPE. I think over the past 3 days, we've passed out over 900 masks alone. Most of the protesters that we've seen actually are wearing masks. And so those that we offer them to gladly accept them. So again, we want to stay focused on the purpose and the message, and we want people to be as safe and healthy as possible. Thank you.
Thank you, Reggie. And Dr. Kowalik was able to join us, so we'll hand it back to you.
All right, thank you all. Good morning or good afternoon. I had some tech issues, so I apologize for that. But as you know, we're dealing with a crisis within a crisis, and I'm sure this may have been stated already. We addressed this yesterday in one of our media updates, but the fact of the matter is COVID-19 is here. It's a pandemic, and we're putting a lot of energy into preventing the spread and keeping people from becoming ill, additional disability tied to COVID-19, and of course death, which is the ultimate goal, is to prevent deaths associated with COVID-19. We know that since last week's events and then all of the demonstrations and protests that started after that fact, there was a number of questions about risk and people deciding whether they were going to go out and take a stand for not only the now, but the future, knowing that the risk of contracting COVID-19 is high, especially when you're congregated. So we know that people have the right to assemble. We've seen this in various places throughout the country, but we also know that there is still this public health threat right now. So I'm glad that Reggie, who's done excellent work through the Office of Violence Prevention and the Mayor's Office related to addressing racism as a public health issue or crisis. And we say that not just because it's cliche or anything like that, it's taking a stand on addressing the elephant in the room. We know that COVID-19 has continued to target many of our Black and Brown communities, as stated even last week, how we're now seeing an uptick in the Latinx community. Now the Latinx community has the majority of the cases in the city of Milwaukee, and African-American rate is second to that at this point in time. So again, just acknowledging that we're in double crisis mode right now, dealing with COVID and also dealing with racism. We also know violence is a public health issue as well, and a public health crisis. So all of these things are connected. We look at racist structures, policies, and practices as the foundation for some of these other issues that we're seeing play out right now. So addressing the foundational problem will help resolve or help to reduce the impact of the other problems. We also know that this is not something that can be addressed in a week. And we know that there's going to have to be some significant change to truly change where we're going as a country right now, as a state and as a city. So, you know, all of those individuals that are going out and protesting, again, we're just encouraging people to, again, understand the risk of being out and about. If you have been involved in any protest activities, you should be wearing a mask, but we're also encouraging people to do that anyway. If you are a carrier, the mask helps to contain the virus. So making sure you're doing that properly, that the mask is actually covering your nose and your to your chin or your mouth. We've seen some people that just have it like this, and we know that's not effective. So making sure you're wearing it properly. The hygiene is where it needs to be as far as hand hygiene, using sanitizer, washing your hands if at all possible. And then getting tested. We know that these community testing sites are still allowing people to be tested if they don't have symptoms, which is important because it helps us understand how prevalent COVID-19 is in certain communities. So definitely take advantage of the testing sites. That they will be up for a while. We don't have an end date at this point in time, but we definitely want to let the community know that we are committed to making sure that there's testing, community testing sites on the north and south sides of town, and that there's also a variety of other outlets for people to get tested, and I'm sure those were mentioned already. Another point I want to talk about related to racism as a public health crisis, because I think a lot of people don't know what that means for us. And at the city of Milwaukee level, when we passed our ordinance following the county, it includes 5 steps or 5 actions that need to happen to truly start moving the needle here. And we were still in the first of those 5 steps, which is the environmental scan, which is to be conducted by the Equal Rights Commission at the city of Milwaukee, looking at every city entity and how we do business, basically. Then the next step is to promote inclusivity within city government, city groups, different departments, and increasing diversity, and not just at the ground level or boots on the ground staffing or direct service staffing, but in leadership. So it's important to have diversity and leadership at all levels. It shouldn't just be the people that are interacting with the community. The next is the reports that come from the Equal Rights Commission being, it's important that those are put into practice for organizations. So it's not something that just sits on a shelf, but they're used to guide systematic change within each city department. This also includes technical assistance and training, and the county has been very actively involved in that too. The next is advocating and drafting policies that will bring about true change. So this is set to increase health outcomes, as well as advocate for social justice and individual advocacy. And then the last is related to encouraging others, including various levels of government, so federal, state, and local, to declare racism as a public health crisis across the country. So my chief of staff, Lillian Payne, has been very instrumental. She was the first one when she was involved with the Wisconsin Public Health Association to bring about this change. And then eventually the county and the Office of African American Affairs and former county exec Abley really helped to move this forward at the county level. And then we were able to do so at the city level through a variety of partners of the Common Council Mayor's Office and Equal Rights Commission. So that is important because once you acknowledge that, it also helps to divert some resources and energy behind making some change. So, you know, oftentimes we talk about racism, we see it from just an individual perspective. But we know that the systemic and a policy level racism is what has really been causing a lot of the issues that we see now. So we, again, are very committed to dismantling racism, and we know that it's going to be a process, but there has to be a commitment, and not just within the city government and the county government, but also within private sector and various organizations that are taking a stand, like using this the Blackout Tuesday as a way to bring awareness to what's happening right now. It's a safe way to protest or show some support or solidarity. It's also noted like people that were using their cars to have like a caravan during some of the protest activities, but just again, looking at ways to reduce exposure while still getting the message across of advocating for true change in our state, in our country, and of course locally here in the city and county of Milwaukee. Thank you.